We look at it, and if you talk to oncologists, we know doctors and providers in healthcare are not getting wealthy out of this. There's not these huge, giant sums of money flowing out to pharmacies and flowing out to normal people. When you're like normally transacting and you're taking care of patients and you're following the rules and sticking within the guidelines of either Medicare, Medicaid, but most especially through the commercial payers, none of the professionals are getting rich. Well, if you look at the total cost of care for medical oncology, the lion's share of the money is going to drugs. So that's a classic case of big insurance company trying to limit the cost, doing everything they can. Poor doctor doesn't have the kind of sophistication and business model to like counteract any of that. And then you have the supply companies, McKesson, Cardinal, Amerisource, who are like trying to push up against that boundary of what is just barely going to allow the doctors to stay in business. And in some cases, they're going out of business. So in oncology, it was really easy. It was like, where's the biggest cost? Drugs. Why is it more expensive than it ought to be? Well, there's a bunch of middlemen involved. And so if you peel back the layers and you said, what if we were able to acquire the drug at the manufacturer? So with all of that in mind, we believe that we can do a Walmart disintermediation more or less on the supply chain of medicine for those types of drugs.